Hi, my name is Vanessa Tanner.
So I'm Byron Castellan. I'm a police officer in Windsor, Colorado.
My name is Amanda Basler.
This is Dr. Susan Entwistle.
I'm Kurt Owens. I'm Deputy Coroner for Texas County.
And the Death Investigation Training Academy was instrumental in helping me get the job that I needed in the field of death investigation.
Well, hello and welcome to this episode of Coroner Talk. I'm so happy that you have joined me yet again for another wonderful show. You know, I have some really exciting news. I just looked at our stats about a week ago and realized that we are over 1 million Coroner Talk podcasts have been listened to. Now, I know on some business podcasts and some of these highly produced true crime shows, 1 million comes pretty quick for them. But for us, investigators, just talking about death investigation and kind of doing our thing over the last few years, we are now well over 1 million. That's a big number. 1 million episodes have been listened to by you. And I appreciate each and every one of you for participating and being a part of that million. I love the podcast. I love training, and I love meeting you guys and gals all over the country where I'm going and I'm teaching. So what are we going to talk about today? Well, today we're going to continue on with some suicide investigation stuff. Again, this is part of a all-new, revamped suicide and self-harm course. And today we're going to talk about victimology. How do we understand the victim? What is there to know about the victim? Where do we get information from about the victim? During our investigation, there's things that we have to do to get to that 70% assurance that it was a suicide. And a lot of that is getting to know and understand the victim. Where do we get that information? How do we get that information? That's what we're going to talk about today. So without any further delay, let's jump into that portion of the training, and I will see you on the other side.
Adjust your earbuds, turn up those speakers, and hang on. It's now time for this week's featured conversation.
All right, I'd like to spend just a few minutes talking about victimology. Victimology is extremely important in all death cases. Sometimes the victimology study is going to be very limited because it could just be an older person that's died with known medical conditions and things like that. Or it could be quite extensive when you find someone that is an unknown in an area of town that they want to identify them. They may or may not have been there, should be there. Now there's a lot of victimology has to be done as to who the person was, things like that. And we're going to talk about it how it relates to suicide investigation. So what is it? What is victimology? Well, it's the study of the victim. So anything with ology means study of, so victimology is a study of the victim. It's a collection and the assessment of any facts as it pertains to the victim and his or her lifestyle. So it's the collection and assessment of everything about this person. Their employment, their job skills, recent events in their life, where they're from, drug activity, alcohol activity, everything about this person. And it's imperative that the investigators get to know the victim through a complete victimology study. We can't rule a suicide unless we can put some type of maybe reason of why they committed suicide, or certainly enough facts to prove or feel that it wasn't a homicide. Because there are times that you're going to have a suicide investigation where you're not going to have a why. I know we always want a why. Well, they lost their job, or they lost their spouse, or they've been depressed because a child died a year ago, or something like that. Well, that's not necessarily something that we could always assign something to. Sometimes people have their own internal problems. They don't share them with anybody. It gets to a point in their life where they decide to die by suicide, and everybody's left wondering, why? On the outside, their life is perfect, and you can't find any reasons why. It could just be during your victimology, you might find that it may be date specific. So on today's date, did something happen in their life? Maybe their father died by this date, or a child died by this date, or 5 years ago today is when their wife divorced them and their life changed completely. And so they've been 5 years worth of struggle, and now on the anniversary of that death or anniversary of that divorce or something. Does today mean something? So when you're doing a victimology, you can look back throughout this person's life and determine if this date means something, if in fact you can't find something readily available as to what might have pushed this person over the edge for victimology. So ultimately, you need to find out in detail who the victim was and what was going on in their life at the time of their death. What was going on in their life and their lifestyle. And the best sources of information are going to be friends, family, employers, neighbors, healthcare professionals, people that they work with, not just employees, but people they work with. And there's two questions whenever you're talking to a witness about anything. It doesn't matter whether it's suicide or any other investigation you do. There's two questions that you always want to end with. If you're talking to this victim's friend and you've done an interview with them and you feel like the interview is coming to a close, ask them, is there something I should have asked you and I didn't ask? Because maybe they have some information that they feel might be relevant, but you didn't ask or give them maybe a clue to tell you that, so they didn't necessarily volunteer it. But when you ask them, is there something I should have asked you and that I didn't ask? Many times, if they have something like that, they'll say, well, yeah, I think it's important to know this and this and this. Okay, and then the second question you ask is, who besides you might know more or better information? Who besides you might know more or better information? And the person said, well, I'm his friend. We've been together since, been friends since high school. We're fishing buddies. I think I know him pretty well. However, have you talked to Bob? Bob is probably one of our other close friends. He probably confides more in Bob than he does with me. Have you talked to Bob? Well, you as an investigator didn't even know Bob existed. Nowhere has that came up in any conversation. Who's Bob? And where is Bob? Where can I find Bob? So now you've got someone to talk to that you would not have known through natural channels. So is there anything I should have asked you and didn't? And who besides you might know more or better information about the X, about the situation, about the victim, about whatever? Who might know more or better? So ask those, and it's going to really open up a lot of doors in your interview process. And of course, you're going to need that in victimology. So part of victimology, when it comes to suicide, is a psychological autopsy. Sometimes it's called a psychological postmortem, right? And you don't have to be a doctor to do this. You don't have to be a psychiatrist to do this. We do sometimes use psychiatrists and psychologists maybe to put some stuff together for us if we feel we need that. But in the end, it's just a method, and it involves collecting available information about the victim, about the deceased. You do this by structured interviews with again, family, friends, coworkers, things like that. And structured interview means you start out the interview with, tell me what happened or tell me what you know, but you have a set of questions that you try to ask everybody, and then you may ask individual questions as that conversation comes up. So you may have 5 or 6 questions that you ask everybody, whatever those questions are pertaining to the case that you're working, the death that you're working. And then because of the conversation, there may be other questions you want to ask, right? Because this person is dwelling on other things, and so you may have other questions. So I'm not saying you only limit to 5 and you leave, but you may have 2, 3, 4, 5, whatever the structure is, and then you kind of go from there. And you're leading these people down a path, but then allowing them to expand and tell what they know or what they want to tell you. So in simple words, a psychological postmortem, again, similar to psychological or postmortem or psychological autopsy, it begins to explain why a person would have taken their own life. Remember, you may not always get that, but it starts to explain why someone would take their own life, or it starts to expose that there is no reason that you can find that someone would take their own life. You can't find any ideations. You can't find any date specifics. You can't find anything about a job loss or an affair or a marriage breakup or, you can't find any of these things. So now that doesn't mean that it's not a suicide, because like I said, there are some suicides where you just can't find a reason why. But when you can't find a reason why, then maybe you have other things in the scene that's questionable anyway. You may not have suicide. It may be an accident that someone made look like a suicide, or it may be a homicide. And so, because you can't now, so if that's the case and you can't find any reason why someone killed himself, you can't find any ideations, there's some things at the scene that's a little bit equivocal, could go either way, then you may have to rule that death undetermined. You don't have enough to call it homicide. You don't have enough to call it suicide. You know it's not natural or accident. And so this may be an undetermined manner. You know the cause, but it may be an undetermined manner because you can't fill in all the blanks. So let's look at some warning signs. Now, sometimes warning signs are things that family members will see later. They don't necessarily recognize them up front as being suicidal, but afterwards, when you're talking to family and talking to friends, talking to neighbors, you're looking for some of these warning signs. Talking too much about wanting to die or to kill oneself. So again, that's a big clue. If you got friends and family telling you, they was talking all the time about wanting to die and life wasn't worth living anymore, that's a good clue. Looking for a way to kill oneself. So if you look at computers and cell phones and look for search histories, and you can find that they've been looking for ways to die, how painless and things like that, that's a good indicator. Talk about feeling being trapped or maybe in unbearable pain. I know I worked a suicide not too long ago where the person had several health problems and they were in constant pain. Medication wasn't helping. Doctors were trying to do what they could to alleviate the pain, but they couldn't. Some of the pain was psychosomatic. Their brain was telling them they were in pain when in fact they were not necessarily in that much pain. So the medication really wasn't working. The medication was working to alleviate the actual pain, but the brain has a way of confusing us and making us feel pain that isn't there. And so some of it was medical, some of it was psychological, depression. The person had just gotten to where they just could not take the unbearable pain any longer. It had been months, it had been almost a year probably, of unbearable pain, and they chose to end the pain by taking their life. Well, looking back on doing a psychological autopsy and looking back on this person's life, you can see where they have mentioned that, and then even the day before, they had even mentioned that they couldn't take the pain any longer, and they just wanted to die. Talk about being a burden to others. You have older people that a lot of times will want to die by suicide because they don't want to be a burden to someone else. I had an ALS patient not too long ago, it's been a couple of years, I guess, that was getting to the point where he was wheelchair bound, and it wasn't much longer. He's going to be bed bound, and then probably on a ventilator soon. And so he was getting really close to being total self dependent on someone else for care. And at that point, wife left for the day, left for the morning or whatever. He had actually been able to crawl out of his wheelchair, get to a firearm that the family had hid all the firearms. They didn't know where one was left, and he shot himself. So he didn't want to be a burden. He had suffered with ALS. He'd suffered it for a long time, and he rode it as best he could. But when it's obvious he was getting worse, he did not want to be a burden, and he had mentioned it so many times. And we found out through the investigation. Increased use of drugs and alcohol, if you notice that. Anxious, anxiety, recklessness. They're sleeping too much or sleeping too little. Someone's habits have changed. Now they barely sleep, or now they're sleeping 12, 14 hours a day or in bed. They feel isolated or withdrawn. They're showing rage or talking about seeking revenge. And then they have massive mood swings. All of these things can be warning signs of imminent suicide. So if you have a victim that's already committed suicide, and through your interviews, you find out some of these warning signs had been existing in this person's life, then that increases your preponderance of evidence towards your 70% sure that it's suicide. Here's some risk factors. Previous suicide attempts, that's a risk factor. Family history of suicide. If grandpa killed himself, grandpa, dad, and now you killed yourself, those increase the risk factors if there's been suicide in your family. recent loss of a relationship, recent loss of a job, easy access to lethal means. Well, that seems silly, but we all have easy access to stepping out on the highway. But are there guns in the house that the person has access to? Are there drugs or medication they have access to? Easy access. Lack of health care, especially mental health care, substance abuse. We see that all the time where people are addicted to drugs. They want to get off of drugs. They cannot get off of drugs. They try it on their own. They don't have health care. They don't have the help that they need, and they just feel helpless, and so they just end their life. And so that's a big risk factor. The feeling of hopelessness, again, history of trauma or abuse, physical abuse, sexual abuse, major physical or chronic illnesses, which I talked about. So all of these things here are risk factors. So during your victimology, you start looking for some of these risk factors to be present in the person's life. Now, suicide is more prevalent in certain groups. Suicide, anybody can be susceptible to suicide in any group or any age, but some ages and some groups seem to have a higher statistical rate of suicide. 15 to 24 years old. That age group, there's a lot of suicides in that age group for, again, they can have mental illness, they can have drugs, alcohol. There's a lot of things that I think if you all raise a teenager or have been around a teenager, they can take something that seems to us to be a very small incident and they can dramatize that up to the world ending because some boy looked at them wrong or something like that. So boys and girls can be kind of dramatic. So teenagers sometimes can't control their own emotions, and if they have other dynamics in their life or in their home life, suicide might become an option to them. My youngest suicide that I ever worked was a 9-year-old boy, and we were able to prove that based upon some writings and things like that in his notebook. Over the age of 60, so when you get to be 60, 70, 80 years old, risk factors for suicide increase, especially if it's because of terminal illness, going down the road to dementia, something like that, it increases. Having mental health or substance abuse disorders, those people that suffer that have a higher risk of suicide. Having a family history of mental health or substance abuse. So it's in your family and you're suffering it and it's a traditional thing. That increases your risk of dying by suicide. Person's family violence or abuse. The person is physically abused, sexually abused, psychologically abused. They're living in an abusive relationship. They may have grown up in one. They may be living in one now and they see no way out. And nobody wants to live in that. Nobody wants to live in where they're being physically, sexually, or psychologically abused constantly. And some people find ways out. Some people have support systems and they find ways out. But if you determine through your investigation that this person was in that type of relationship and you can see where they didn't have a way out, they might have chose suicide as a way out. In prison or in jail. That we have to really watch prisoners when they first go in. If they get sentenced to a long term, if they're facing some pretty severe charges, in jails, in prisons, statistically, there's a high rate of suicide. We already talked about chronic pain and illness, and of course, access to weapons. So in today's world, we need to talk a little bit about the LGBTQ community, and I think there's some other letters on that maybe too, and I'm sorry if I forget all of them. But lesbians, gays, bisexual kids, are 3 times more likely than straight kids to attempt suicide at some point in their life. Now, kids, it's going to be that 15 to 24. I know 21, 22 is not necessarily a kid, but that young age group. It's hard enough being a teenager and a young adult. It's even harder when you're struggling with transgender or bisexual or homosexual issues. And in today's world, there is a big push to be all you can be as gay as you can be. And then there's another push to be, don't be gay, don't be gay. And then so these kids are caught in the middle. And they're already confused with their sexuality, with who they are as a person. And then with these two forces coming against them, they're being pushed into it or being pulled away from it. It can get very confusing. And some of them choose to end it by suicide. LGBTQ youth are 4 times more likely to make medically serious attempts. Means they may not have succeeded, but they have tried. So look in their, if they have a successful attempt, look in their history to see if they've tried. Sometimes, as we know, attempts are attention getters. And if they make these attempts, they don't want to die, they want help. However, if that help does not come, or does not come in the way that they feel it should, and their problems aren't resolved, weeks, months, or a year later, then they may make a final attempt and succeed. So when you have, earlier on I said that African American, Latino, Native American, Asian American, their risk factors for suicide are different just by their race, okay? So African American and Latino are very low suicide risk. They just don't statistically commit suicide, die by suicide. But Native American, Asian, or Native American certainly is very high, Asian's low. But if you throw in there the homosexuality, transgender part of that, then the Latino, the African American, Black, Asian, all that increases dramatically. Even when they were not necessarily very high on the risk factor for suicide, it now becomes very high in many ways for the same reason. The same reason why, because of faith, family, culture, that they are very low for suicide, okay, culturally. Now, because of those same values that make their suicide rates go down, those same values also now in the gay, transgender, homosexual community makes those same reasons make them now a higher risk factor for suicide. Gay and bisexual boys are 4 times more likely to attempt suicide than heterosexual men and boys. So if they're a gay or a bisexual boy, male, then they are 4 times more likely than heterosexual male. So during your investigation, you find out that they are transgendered, or they are bisexual or bicurious or homosexual. You need to put that as a risk factor. And that's not being a negative. That isn't a negative against the gay and transgendered community. That's not what this is. What I'm saying is there is statistically, a high suicide rate among the gay and lesbian community and the transgender community. Knowing that, then we need to consider that as a risk factor when we're doing our investigation. Remember, we have to get to that 70% in our minds, our 70% rating, that this was a suicide. That is the risk factor. And that wouldn't be the only one. That's not the only thing. But when you have a preponderance of evidence, that has to be part of the evidence in your investigation. Because we have to go nationally based on statistics. So another thing about victim history here is social. Again, I talked about talking to friends, trying to find out if they know of reasons why, if they know of any ideations or past attempts or anything like that. And then medical. Now, one thing I have to point out about medical is your coroner and your medical examiner can get medical records easily by request only. They don't have to have a subpoena. All states honor medical records released to coroners and medical examiners when investigating a death. Police, you have to get a search warrant, or have to get a subpoena. Now, coroners and medical examiners can pull those records, they can review those records, and they can review those records with law enforcement. But if you're going to get your copies, then you have to get them through subpoena. But it is important that you do get some medical records, especially if you're trying to determine if there is a medical situation like a cancer diagnosis or something. Psychological, if they're seeing a counselor or psychiatrist currently or in the past, you need to look at those records. I will tell you that medical records are easier to get than psychological records. And what I've been told and what has worked is they don't like releasing the records for various reasons. But one of the main reasons is because sometimes during counseling and therapy conversations, the victim will discuss something that involves someone else. So maybe they were having an affair, not anymore, but they were, and that's causing some issues. They're talking about the person they were having an affair with. Maybe they were discussing a homosexual issue. Again, it's not public, and so that not only does it bring a bad light per se on them, that may have been what they're trying to protect, but also it may bring somebody else that is otherwise a living heterosexual that's now going to be called out as being homosexual because of the notes that are in this psychological or this counseling session. So they don't like to release those notes because it involves other people sometimes. So here's what I found work. I've set appointments with the counselors, and I've said, look, I want to come in and review the records with you. I need an appointment. Of course, I do not pay for that appointment, but I need an appointment. I need to come in. If not, I'll just subpoena everything you got. But without that, then just come in, let me read them. Let me ask you some questions about what I'm reading in your notes. If there is something that I really feel I have to have as part of my investigation, we will discuss it. We can make copies of it then before I leave. But in many times, once I read the notes, I don't have to have copies of things. And there are many times, none of that really is going to be necessarily pertinent. And that will many times help you get look at those records, because they know that you're not taking the entire record out of the office. They're there with you while you're reviewing it, and you're talking to them, and you will probably gain the information you need just by doing that. And that makes them a lot more cooperative. So victimology can be pretty intense, and it needs to contain enough information in it that you can use it towards the preponderance of your evidence. You can't just look at a person dead and say, yep, it's suicide, without doing a history, a medical, social, psychological, looking at the risk factors and doing a good victim study over ever how long you think it's going to be to come up with that preponderance of evidence. You are not doing a successful suicide investigation if you don't have a victimology part of it. Now, how extensive that's going to be depends on you and your investigation. I'm not suggesting that it's going to take, 90 days of constant work to prove the suicide. Okay, it might just take a couple of days talking to a couple of friends, and you've got the information you need and you can verify it. But consider the victimology need and how that's going to work in your investigation. Because again, you have to have a report that someone else can come along and read and say, yes, I agree that why you came up with suicide because of all that you did and all the information that's in here. And the study of the victim or victimology is certainly something that has to be part of that investigation.
All right, I'm back with you. So again, I hope you enjoyed that little excerpt of training. Lots of good information there. Some you may already know some of it. Some of it you've already done. But I'm sure you picked up some nuggets and things that'll help you not only on your next suicide investigation, but literally there's things in there that can help you about any death investigation and talking to witnesses and getting information from people. There's a lot of valuable golden nuggets in there. And of course, you go back and listen to that if you didn't get all the notes taken and you want to hear more. So again, remember, check out our training, check out to see what's around you. If you want training brought to your area, I'll be glad to come to you and teach some courses up in your area. Go onto the website, go to the Academy website under classroom training and see what's around you, though. So we don't want to bring something within 2 hours of you so we don't cannibalize both training. So just see what's around you, and if it's far enough away or you want to bring something to your area, reach out to us by email. They'll get it to me, and I'll start a conversation with you, and I will be glad to come to that area. So again, thank you again for 1 million downloads, and I also thank you for coming along with me on this journey today. So as I always like to close the show, I want you to find a way to bless somebody in your life. It can be a big blessing. It can be a small blessing. Sometimes, we grow weary of blessings, but do what you can to be a blessing in someone's life today. And I want you back next time. So above all, be safe.
Thanks for listening to Coroner Talk, a DSPN media production. Visit our website at coronertalk.com. And be sure to like us on Facebook at facebook.com/coroner training. 3617 1024 scene en route to morgue.